Hello everyone. Today's episode is for adults age 50 and above, especially for current smokers, former smokers within 15 years, those exposed to secondhand smoke, or anyone with a family history of lung cancer. Today's topic is lung cancer, the #1 cancer killer in the United States and worldwide. In the next 12 minutes, let us walk through this together. Let me start with three numbers. Number 1, global. In 2022, the world saw 2.48 million new cases and 1.8 million deaths from lung cancer. It is the most common cancer and the leading cause of cancer death worldwide. Source: GlobalCan 2022 from the World Health Organization IARC. Number 2, United States. The American Cancer Society estimates 234,580 new cases and 125,070 deaths in 2024. Lung cancer kills more Americans every year than breast, prostate, and colon cancer combined. Number 3, and the most important, 5-year survival. SEER data shows localized stage at 64.7%, but distant stage drops to just 8.2%, a more than 7-fold difference. Lung cancer is not a death sentence, but early detection is everything. So what is lung cancer? In one sentence, lung cancer is malignant growth in the bronchial mucosa or glands of the lung. There are two main types. Type 1, non-small cell lung cancer, or NSCLC, 85% of cases, includes adenocarcinoma, squamous cell, and large cell. Adenocarcinoma is now the dominant subtype, especially in non-smokers and Asian women. Type 2, small cell lung cancer, or SCLC, 15%. Aggressive, fast-spreading, but responds well to chemotherapy and immunotherapy. A simple analogy: NSCLC is like a slow-rising flood. SCLC is like a sudden tsunami. The treatment strategies are completely different. There are 8 major lung cancer risk factors. Number 1, smoking, the #1 cause. 80 to 90% of U.S. lung cancer deaths trace to smoking. Smokers face 15 to 30 times higher risk than non-smokers. Number 2, secondhand smoke. Non-smokers exposed at home or work face 20 to 30% higher risk. Number 3, radon, the leading cause among non-smokers. Causes about 21,000 U.S. deaths per year. Test your basement and first floor. Number 4, occupational exposure. Asbestos, uranium, silica dust, diesel exhaust. Risk rises several-fold. Latency over 15 years. Number 5, air pollution. Long-term PM 2.5 exposure accounts for 1 to 2% of U.S. lung cancer deaths. Number 6, family history. A first-degree relative with lung cancer doubles your risk. Number 7, chronic lung disease. COPD, pulmonary fibrosis, prior tuberculosis. Number 8, age. Incidence climbs sharply after 50. Lung cancer often has no early symptoms, but 5 warning signs deserve your attention. First, persistent cough, lasting more than 3 weeks, especially in smokers when cough character suddenly changes. Second, blood in sputum, even once. About 7 to 10% of lung cancer patients cough up blood. Third, chest pain, worse with deep breathing or coughing. Fourth, hoarseness, persisting over 2 weeks. May indicate tumor compression on the recurrent laryngeal nerve. Fifth, unexplained weight loss, greater than 5% of body weight within 6 months. If any one of these appears, especially if you are in a high-risk group, please see a doctor immediately. Do not wait. Now please listen carefully. 5 red alerts. Anyone means see a doctor today. 1, hemoptysis, coughing up blood, even traces of blood or rusty sputum. 2, cough lasting over 3 weeks despite treatment. 3, unexplained weight loss exceeding 5% within 6 months. 4, new persistent chest pain, especially radiating to the shoulder or back. 5, clubbing of the fingers, thickened fingertips and curved nails, a possible sign of lung tumor. These are not symptoms to wait out. They are your body sounding the alarm. Here is the most important point. Early-stage lung cancer has no symptoms. The only proven way to find it is low-dose computed tomography, LDCT. What is LDCT? Standard chest CT delivers around 7 millisieverts. LDCT delivers only 1 to 1.5. Roughly the same as 1 mammogram or 6 months of natural background radiation. The landmark NLST trial from the National Cancer Institute proved that annual LDCT screening in high-risk adults reduces lung cancer deaths by 20%. Nodules found on LDCT are managed by lung rads. Categories 1 and 2 are benign, annual follow-up. Category 3, 6-month court. Category 4A, 3-month court. Categories 4B and 4X, immediate biopsy. Remember this. LDCT is the only screening tool proven by large randomized trials to reduce lung cancer mortality. Chest X-ray does not work. Blood tests do not work yet. Why start at 50? In 2021, USPSTF lowered the start age from 55 to 50 and the pack year requirement from 30 to 20. The reason? Strong benefit was found in the 50 to 54 age group. What is a pack year? 1 pack per day times years smoked. 1 pack a day for 20 years equals 20 pack years. 2 packs a day for 10 years also equals 20. NCCN 2024 mirrors USPSTF. 50 plus and 20 pack years. Japan's National Cancer Center 2025 guideline, 50 to 74 plus 30 pack years. 3-country consensus. Once you hit 50 with enough smoking history, get an annual LDCT. Without fail. Look at this most important chart. Stage 1. 5-year survival around 90%. Surgery is curative. Stage 2. About 60%. Stage 3. 30 to 40%. Stage 4. Metastatic disease. Spread to bone, brain, or liver. 5-year survival drops to 8.2%. SC 2024 summary. Localized at 64.7%, distant at 8.2%, a gap of more than 7-fold. This is why we keep emphasizing early screening. Same disease, found 1 year earlier, could mean jumping from 8% to 90%. Modern lung cancer treatment is staged. Stage 1, surgical resection, sometimes adjuvant chemotherapy, minimally invasive thoracoscopic surgery, 2 to 3 days in hospital. 5-year survival, 80 to 90%. Stage 2, surgery plus adjuvant chemotherapy, sometimes targeted or immune maintenance. Stage 3, multimodal therapy, chemotherapy plus radiation plus immune maintenance, such as durvalumab. Stage 4, systemic therapy is primary, targeted drugs, immune checkpoint inhibitors, combination chemotherapy, surgery only for symptom relief. Remember, each stage has its own strategy. Stage first, then decide. Never rely on hearsay or what a neighbor told you. 2024 was a breakthrough year for lung cancer treatment. The FDA approved 11 new NSCLC therapies in 1 year. Molecular profiling is mandatory. In Asian non-smoker adenocarcinoma, EGFR mutations occur in 50 to 60%. ALK rearrangements about 5%. K12C around 13%. ROS1, BRAF, MET, RET also have targeted drugs. EGFR positive. Osimertinib first line and now stage 3 unresectable indication added in 2024. ALK positive. Alectinib received FDA approval in 2024 for adjuvant therapy after surgery. PDL 1 above 50%. Pembrolizumab single-agent immunotherapy. Small cell lung cancer limited stage. Durvalumab maintenance. Adriatic trial. The first major SCLC breakthrough in 50 years. Avoid these 5 myths. Myth 1. No symptoms means I am safe. Wrong. 80% of early lung cancer has no symptoms. Detection requires screening. Myth 2. My chest X-ray was normal. Chest X-ray misses many nodules under 1 centimeter. LDCT is the standard. Myth 3. I quit smoking 10 years ago. USPSTF still recommends screening if you quit within 15 years. Myth 4. I never smoked. This does not apply to me. 10 to 20% of lung cancers occur in non-smokers, especially Asian women with adenocarcinoma. Myth 5. Lung cancer is a death sentence. Stage 1 survival is 90%. Targeted and immune therapy now extends stage 4 median survival from 1 year to 3 to 5 years. 8 things you can start today. First, quit smoking. Anytime you quit is better than continuing. Risk drops by half after 10 years smoke-free. Second, avoid secondhand smoke. Third, test your home basement and first floor for radon. Fourth, use kitchen exhaust fans. Avoid high-temperature stir-frying with rapeseed oil. Fifth, wear an N95 mask on high PM 2.5 days. Sixth, exercise 150 minutes per week. Research shows exercise reduces lung cancer risk. Seventh, eat cruciferous vegetables, broccoli, cauliflower, and tomatoes. Eighth, starting at 50, get an annual LDCT if you qualify. Please remember these 5 lines. First, lung cancer is the #1 cancer killer, but early detection makes it curable. Second, smoking is the chief offender. The earlier you quit, the bigger the benefit. Third, from age 50, get an annual LDCT if you qualify, without fail. Fourth, 5 red flags: hemoptysis, persistent cough, unexplained weight loss, chest pain, finger clubbing. Anyone means see a doctor immediately. Fifth, lung cancer is not a death sentence. Stage 1 is curable. Stage 4 with targeted and immune therapy means living with cancer for years. At the end of this episode, 3 things you can do right now. First, schedule an LDCT scan if you are over 50 and currently smoking or quit within 15 years. Second, test your home for radon. Kits are about $20 online. Third, if you smoke, set a quit date. Any quit date beats continuing. Your lungs have carried you a lifetime. Take good care of them. Information in this episode comes from the following authoritative sources. This program is for health education only. It is not a substitute for medical advice from your doctor. If this helped you or your family, please like, share, and subscribe. Trust AI Security Health Science Series. See you next episode.